Hello, everybody. Andrea Turowski here with Dentalelle. I am going to be talking to you guys today about something that is actually very important to know for the office and not something that you necessarily want to go over and read the textbook for. Now, this will actually make you sound a lot smarter in front of the dentist and your patients as well. Because as a dental professional, we are always looking at the mouth. Obviously, we are checking to see, well, do they have perio? Do they have gingivitis? Are they on their way of getting gingivitis? Do they have a lesion? You're checking for oral cancer, all of those things. But while you're sort of checking for these things, it would help to be able to explain to your patient what you're actually looking for. And especially for those patients who say to you, so I come every 9 months, but you're now telling me to come every 3 months. Why? You know, it's one thing to say, well, because your gums and teeth look horrible, you don't brush or floss, but it's another thing to explain why, to explain to them there are certain bacteria in the mouth that you have, good and bad, but because you don't brush and floss, these types of bacteria have actually taken over. And by you coming in every 3 months will help to limit the bacteria. If you don't come in every 3 months, this is what could happen. So let me explain some things to you, and I'll be sharing my screen. So let me just share my screen right now. So I do have a PowerPoint that I made for everybody to kind of make this easier to see. So can everybody see my PowerPoint okay? It should say inflammation and repair. Can you guys see me? I don't know if you can or not. I'm sorry. I can't see myself, but hopefully you guys can see me. But if not, then that's okay. I think just the main thing is that you can hear me. So even if you can't see me, that is okay. Okay, so for inflammation and repair. So this is more for your knowledge. So think about what could cause injury to the tissues for the most part. So it could be from actual trauma. So if the patient's eating the insides of their cheeks all day, every day, you will be able to see that when they come in to see you. And I see patients do this all the time. And some even say, hey, I've seen something on the inside of my cheek here, it looks kind of white. Is that normal? So then you just have to say to them, well, that is actually a case of a physical injury. So that is something that you are doing, all day or at night without even knowing it. But you actually should stop, because the more times, I guess, you do that, the more inflammation it is causing, and that actually causes you to do it even more. So it is helpful to explain these types of things. So let me just move to the next slide here. And then you could be saying, or they may even have questions saying things like, okay, so you're telling me that my gums are red, swollen, and they're inflamed. Well, what does that mean exactly? And you do, and you will have patients that actually say that to you. So when that happens to me, I go, oh wow, like this person actually cares, and this person actually wants to know. So if you want to take it a step further, you could say something like, well, you have chronic inflammation and you also have acute inflammation. Your inflammation is more chronic because it has been happening over a longer period of time. Or let's say they have a popcorn kernel stuck, if they have a popcorn kernel stuck, you could say, well, this is the only area that seems red and a little bit swollen, and that's because you have something stuck in there. Now, this is called acute inflammation because this happened over a short period of time. But then as soon as the source of the inflammation is actually taken away, then it can actually heal properly. So same thing goes for your chronic inflammation. When the source is taken away, it can start to heal. So does that make a little more sense? I mean, I'm not saying that you have to be that specific with every single patient, but if they have questions, that may make the difference from them saying like, oh, so I guess I do have to come in every 3 months because you're telling me I have chronic inflammation, which has been happening in my mouth over a long period of time. And if I had that on my arm, for example, if I had a cut on my arm, I'd be more concerned. So you're telling me technically that I have cuts inside my mouth and it's chronic inflammation. Oh my God, like that just sounds horrible. So even if they have no idea what you're saying, they'll go, okay, well, she's using some pretty big words here. That sounds pretty, oh my God. So I guess I should be coming in every 3 months, because at the end of the day, you want your patient to be healthier. The best way for them to be healthier is to start in the mouth, because mouth equals overall health, right? And they may not know that until you actually explain things to them. Okay, so next slide here. So just pretty much, this isn't something that I'd say you have to explain to your patient, but keep in mind that inflammation has many different forms. So if the gums are red, that means that the gums are inflamed. If the gums look swollen, they are inflamed. If the gums feel hot, to the patient, it is inflamed. So just something to think about. Next slide here. And of course, the classic sign, if say you are probing your patient and a pocket, you are like, oh my God, I just probed and pus is coming out everywhere. This can't be good. That is not good. That means they have active inflammation. They have active infection, which could mean they have an abscess. So if you see pus, automatically take an x-ray. I mean, technically, you should be asking the dentist first if you can take the x-ray, but you should be taking the x-ray because they may have an abscess, okay? So pus is never a good thing. Okay, white blood cells. So for those patients who do like to ask a lot of questions, I will say something to them like, let's see here. I'll say something to them like, you do have active inflammation in the mouth. So your white blood cells are taking over, trying to fight that inflammation. But I can help you by you coming in every 3 months, making sure that everything's as clean as possible. If you come in every 6, 9 months, or every year, those white blood cells are constantly taking over, and you will probably become sick a lot more often because of that active inflammation that is in the mouth. And you probably don't want to be sick, right? Because if you're sick, then you have to take time off work, which is actually costing you money, which isn't good. So yes, you have to pay more technically to come see me every 3 months, but you're actually saving money in the long term for you, for your health. Things are a lot healthier, and you don't have active inflammation in the mouth because it takes a series of 3 months. So if you're coming in every 3 months, I am actually helping you fight off that active inflammation. Plus, make sure to brush twice a day, floss once a day, so that helps even more. So if you want to take it, a step further, you can make it sound even more confusing to them by talking about the white blood cells. You can talk about chemotaxis here, which I don't normally go that far because I don't quite understand it myself, but things you could talk about. Oh, and I do have some questions for you guys, which we don't necessarily have to go over, but I will attach the PowerPoint for you so that you can sort of answer some of the questions. But let me go through a few for you here. So let's see, this might be a good one, because if you're talking about the whole inflammation process, if you use big words, let's be honest, your patients will likely say, oh wow, like this sounds serious. She's talking about inflammation, which sounds serious, so I should be coming in every 3 months to make it healthier for me, So as an example, so what are the 2 types of white blood cells involved in the initial inflammatory response? Any ideas? So think white blood cells. So of course, lymphocytes, right, is one of them, or maybe it's one of them. Sorry, I don't want to say, because that's not necessarily the case. But even if you're not sure, this is good to know. So any ideas? Okay, Let's talk about it. Okay, so neutrophils and macrophages. So lymphocytes isn't, sorry, it's not a type of white blood cell, but it is involved in the whole process. So think about when you feel like you're getting sick. I know for me, my lymph nodes, especially around my neck, I'm I'm always like, okay, they seem a little bit sore, they seem a little bit swollen here, you know. That's because I am starting to get sick, which means inflammation, which means more white blood cells. So more white blood cells are coming to the area, causing my lymph nodes to be swollen. So anytime you have more lymphocytes, which are the cells of the lymph nodes, it means you have more white blood cells, which means something's happening. Your body's trying to fight off the inflammation, trying to fight off infection, okay? But the two types per se of the white blood cells are C, the neutrophils and the macrophages. So if you want to sound more confusing or smarter to your boss, to your patients, use those terms. You know, say you have active inflammation, which means your neutrophils and your macrophages are working overtime. And again, to your boss, you will sound super smart. To your patients, they'll be like, okay, what? Can you explain that further? And then you can say, well, what I'm trying to say is, you're not as healthy as you could be because your cells are trying to work overtime to fight off the inflammation. But if you come in every 3 months, you have less of those cells, less inflammation, and you are healthier. So you see how that sort of all ties in? Let's go over one more. I'm sorry. Okay, this we don't necessarily have to go over yet. We don't have to go over this necessarily. So as you can see, you guys, there's lots of questions here for you. I was just trying to find one that you would use for the real world. But these are kind of like questions, like board exam type study questions. I talk more about the lymphocytes here. Okay, well, let's look at this one. So let's say your patient has chronic perio. It means they have chronic inflammation. So it is happening over a long period of time. So what is the distinct form of chronic inflammation? A, B, C, or D? Any ideas? Think about it. Stop the video if you have to. Answer is A. So if you want to sound super duper confusing and smart at the same time, say to your patients, you know, I am seeing you have chronic inflammation because, and I'm probably not even saying this right, you have a term called granulomatosis inflammation, which means your granulomas are surrounded by lymphocytes and plasma cells. Those lymphocytes come into play with the white blood cells when there's inflammation. So when you have too much, you have inflammation. So you need to take away that source of the inflammation. And the source is likely too much plaque, too much tartar. You have plaque, and then the plaque hardens, becomes tartar, and then plaque forms on top of the tartar because it's the actual plaque, you guys, that causes the inflammation, not the tartar, but the plaque that forms on top of tartar. You need to take away the tartar and, of course, the plaque because they cannot take away tartar with their toothbrush. They can take away plaque with their toothbrush, but they can't take away tartar. So that's why, again, it's so important for them to come in every 3 months so that you can help them. So as you can see, you guys, there's tons of questions. This was a recent class that I taught with my Dentalelle members who are part of the Board Exam Prep Academy or the Dentalelle student program. So even if you're still in school, you know, or you are studying to take the board exam, I can help them because this is what I teach. I just love this stuff. When I was a student, I hated it, but now that I'm starting to understand it, you know, because I've been doing this now for 13 years, I love it and I can help. So hopefully I made that a little more exciting for all of you here. I'm just going to stop sharing my screen here. So hopefully I made that a little more exciting about oral pathology and then how you can actually explain things to your patient so they listen to you and so you can sound smarter at the dental office. Any questions? Please let me know.